regional partners to co-develop an AI tool to predict diseases better. That's so we're better covered when the next COVID hits. And for more on the AI platform PathGen, we speak to Dr Louisa Sun, who is a Deputy Director at the NUS Centre for Infectious Disease Emergency Response. Dr Sun, welcome to the show. Now, first of all, how will an AI-powered tool fill the gaps in our pandemic preparedness system?
Yeah, so I think it's really helpful to have AI tools like this, whether we're talking about it being a technologically advanced country like Singapore, or even in places with more limited resources, because these tools can really enhance and boost the systems that we already use to detect new and evolving health threats by looking at many signals at once and also pointing out patterns that we may not see. And so this is important that we remember that the AI tool itself, though, doesn't replace the people who are actually doing the surveillance, but it can give them better information that can be analyzed faster. And that extra lead time often can help everyone prepare and respond more confidently to outbreak events.
Now, 5 ASEAN countries have also agreed to co-develop this tool as a shared public good. What will being part of this process mean for clinicians and doctors in Singapore?
So I think the information that flows downstream to us, again, from any type of tool, that gives us a large surveillance network, the information produced gives our frontline teams a much clearer heads up about what might be heading our way. And if we know early which illnesses, we can plan ahead more effective, which illnesses are rising around us, we can plan ahead more effectively, because the doctors and nurses and other frontline healthcare workers are often the ones who feel the most impact first. And in order for them to keep our healthcare services safe and running smoothly, we need better foresight. And they can then protect themselves as well as the patients and the communities they serve better. And having AI tools like this to help can make a huge difference, especially in surge scenarios.
And speaking of those patients, Dr. Sun, how about them? How would it actually involve them when it comes to using these AI tools?
So a lot of times, if we want to track how infectious disease are spreading or want to know more about the characteristics of an infectious disease and how it's changing, we need people and patients to come forward to be tested in the first place so we can collect the samples. So if people are worried about their personal health information not being protected properly, they may not come forward. So one of the big things in these platforms, especially when sharing data cross borders, is data privacy and governance. So we need to protect information that is collected. We need to make it confidential and make sure that patients know that their information is being protected so that they still can come forward for testing and treatment. And so on a broader level as well, if someone alerts or inserts incorrect data into our systems with the wrong patient information, then the analysis or interpretation that we get out of those systems could lead to wrong calls being made across the region, and that can be very serious. So, whether it involves patients or, just data protection, strong security measures isn't just a technical issue, it's really core safety component of any system.
And the patients definitely have some responsibility with regard to that. But what can go wrong, and what are some of the risks involved if the countries don't take active steps to secure or protect their own health data while using a system like this?
So this is a problem that also comes across with any large data sharing platform, especially when you're using AI. So AI doesn't really understand context well on its own, and it can easily get distracted by noise or miss things out, especially when there's not enough data or the data is of not good quality. So again, if we're not able to collect enough good quality data from a wide-ranging number of patients, then the interpretation of this data that we get can become very skewed. So again, but apart from these platforms and AI, we really need the people like our scientists, our public health experts, as well as the decision makers who understand policy. They still need to look at the signals and the outputs and inputs into the AI platforms and decide what they actually mean, what do we need to collect, and how we appropriately use the data that's coming out of these systems. And we need to make sure that we're collecting the right information to feed into AI. And that, again, depends on, our patients trusting the systems and cooperating with us.
Now, it's still early days yet, but what sort of firepower do you expect AI to bring to Singapore's pandemic preparedness, maybe in the short to medium term?
So I think AI tools can help us notice changes or notice changing patterns earlier. We see patterns that we might otherwise miss or only detect later. And these tools can give us an early sense of where the problems could be building up in a region or in a country. So practically, this means that we don't have to wait until a situation is already very large scale or obvious before we start paying attention and developing our responses. So while AI or these tools won't be able to fix every challenge that we face in pandemic preparedness and response, it gives us a lot more leadway and time to prepare, and it gives us more clarity about what to focus on, and also helps to build more confidence in the decisions that we make. Because when we have better insight earlier, we can move faster and target our efforts and our resources where they will make the most difference.
And speaking of building that confidence, where then might a system like this potentially fall short or maybe even need human judgment to avoid misinterpretation?
So like I mentioned earlier, AI is just a tool. And when using any AI tool, we really need our domain and our knowledge experts together with our decision and policy makers who can understand what the AI tool is supposed to do and use its information appropriately. So for example, if we need to collect data on influenza and we want to study influenza trends, we can't use that using dengue test results, which might be fed into one part of an AI system. So we really need to be able to distill what information we're using and how to analyze and interpret properly to get a full picture that really makes sense and will be helpful to us. So AI, again, can be a great tool, but still relies on people and experts on the ground with the real world experience to understand what's happening.
Dr. Sun, thank you so much for sharing your views with us. I've been chatting with Deputy Director of NUS Centre for Infectious Disease Emergency Response, Dr. Louisa Sun.